Hello, everyone. Welcome back to the MRI Registry Review Exam. These are practice test questions and answers for patient care in MRI. And this is the content specification for the ARRT website. I am certified through ARRT. That's why I'm following the type of question that they will ask you or could possibly ask you on the MRI registry. However, you can use this if you are studying this for your ARMRIT exam. It goes both ways. A lot of students study the same thing. It's the same thing, probably a different question format. All right, so with my Q&A, I like to read the question, the answer choices, and then I'll pause for a second and give you all time to answer. If you would like more questions, let me know. A lot of people, they commented on my poll or not commented. They took my poll, and some people said they wanted 20 questions in a video. Some wanted 30, some wanted 50. So I'm not sure how many to put in a video. But if it does get long, all you have to do is pause the video, write down whatever question you stopped on the time, and then just come back and just keep rewatching. But other than that, we'll get started. Question 1. Which of the following would be considered a normal blood pressure? A, 90 over 50, B, 100 over 60, C, 120 over 80, or D, 150 over 90. I'll give you a few moments and then I'll give you all the answer. All right, the correct answer is C, 120 over 80. That is considered a normal blood pressure, and mmHg stands for millimeters of mercury. Question 2. A normal pulse rate range for adults is between A, 20 to 60 beats per minute, B, 40 to 70 beats per minute, C, 60 to 100 beats per minute, D, 100 to 120 beats per minute. Okay, the correct answer is C, 60 to 100 beats per minute. Question 3. Which contrast medication is used in MRI to visualize pathology, infections, and tumors? A, diazepam, B, gadolinium, C, iodine, D, Xanax. Okay, the correct answer is B, gadolinium. I'm sure everyone got this answer right. Gadolinium is contrast that is used in MRI, also can be called deuterium if you all use deuterium. Diazepam and Xanax can be used and given for claustrophobic patients that are anxious about the MRI scan. Iodine is a contrast medication that is used in CT. Question 4. During the MRI scan, patients must be given blank for their hearing protection. A, earplugs, B, earplugs and headphones, C, headphones, or D, patient does not need hearing protection. Okay, the correct answer is A, earplugs. Patients must be given earplugs to protect their hearing from the loud MRI machine or their hearing can get destroyed. Patients are not required to have both earplugs and headphones in at the same time. So please do not let patients refuse hearing protection. I've had patients say, I've lost most of my hearing, or I'm deaf in one ear, or I have terrible hearing in the other ear. I still give them earplugs because number one, you never know if they are deaf or not, or if they can hear or not. So if they're telling you this and then let's say you end up not giving it to them and they really lose their hearing, then you can be sued. And then another thing is you have to give them hearing protection. This is by law. I've had patients come in with their own earplugs and say this fit the best. You cannot use their earplugs. Their earplugs have not been created and tested and made as far as what the FDA recommends and requires. So use the ones that you have at your facility. Question 5. A hypoglycemic patient is a patient that has A, claustrophobia, B, high blood sugar, C, high blood pressure, D, low blood sugar. Okay, the correct answer is D, low blood sugar. Hypoglycemia, also known as low blood sugar, occurs when blood glucose levels drop too low, which could be below 70. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Thank you. Question 6. A patient arrives for an MRI scan and has a glucose monitor on their arm. This device is most likely for a patient with what kind of medical condition? A, anxiety, B, diabetes, C, high blood pressure, or D, low blood pressure. All right, the correct answer is B, diabetes. So a lot of diabetic patients, they must remove that diabetic glucose monitor. A lot of them have this, some of them don't. A lot of them may have it, a lot of them may not. But you will see this type of monitor on patients who have diabetes. Some patients may tell you, hey, I've had this scan before with my monitor on, no one made me remove it. Have the patient remove it because a lot of patients get the CT and MRI machine confused. So if you don't remove the monitor, it can burn you. I wouldn't let a patient tell you anything otherwise because that glucose monitor has a needle and a sensor. So some patients may not want to remove it because it is expensive, but they have to remove it. Let them know it can heat up, it can cause a burn. It also can cause probably an inaccurate reading for their blood sugar. So let me know in the comment box if you have seen this monitor on a patient's arm before because I'm not sure how far you all are in your program and your clinical setting and how much experience you have. So let me know if you've seen this monitor before. It can also be found on a patient's stomach. All right, question 7. The normal respiration rate for adults are A, 0 to 10 breaths per minute, B, 5 to 15 breaths per minute, C, 12 to 20 breaths per minute, D, 25 to 50 breaths per minute. Okay, the correct answer is C, 12 to 20 breaths per minute. Question 8, fill in the blank. Hypertension is the medical term for, okay, the correct answer is high blood pressure. So hypertension is the medical term for high blood pressure. Question 9, fill in the blank. Hypotension is the medical term for right? The answer is hypotension is the medical term for low blood pressure. Question 10. How many hours must a patient be NPO before their MRI MRCP examination? A, 0 hours. Patients do not have to be NPO. B, 1 hour. C, 3 hours. D, 4 hours. Okay, the correct answer is D, 4 hours. A patient must be NPO, have nothing by mouth for at least 4 hours before their MRCP exam. And as you can see, MRCP stands for magnetic resonance or resonance cholangiopancreatography. So let me know in the comment box if you all knew what MRCP stands for. I know a lot of people who may have their ARRT certification know what cholangiopancreatography is because we go to surgery and do that for x-ray. But if you're with ARMRIT, just let me know in the comment box if you knew what that stood for. Question 11. Identify this image. Name the object that is seen on this chest x-ray image. So what is the red arrow point to? Okay, the object is an electronic pacemaker device. A pacemaker is a small battery-powered medical device that helps regulate a slow or irregular heartbeat by sending electrical impulses to the heart. Verify the patient's implant card and reach out to a representative for programming the pacemaker for the MRI scan. So, at the hospital I work at, or probably any hospital in general, I used to work in an outpatient imaging clinic, but to be honest with you, they never did that. But by me coming from a hospital setting, I always check to see if a patient had like a X-ray or a CT scan. So before we scan patients in a hospital setting, you supposed to, and we do, we look at their chest X-ray, any previous X-rays they've had, because a lot of patients have had new surgeries or they are mentally altered and they cannot answer the screening form questions, and you cannot trust anyone else to answer the screening form questions for them. So by looking at their chest x-ray, their KUB, which is their abdomen x-ray, their CT head scan, you can see if there are any implants in their body. If so, you can read the report and see if the radiologist listed a stimulator, a pacemaker, or any other electronic device, or you can reach out to the radiologist for them to just confirm what it could be. But regardless, you can't scan the patient unless the patient has an implant card. Question 12. Which of the following would be considered a normal creatinine range? A, 0.2 to 1, B, 0.5 to 1.5, C, 0.5 to 3, D, 1 to 5. Okay, the correct answer is 0.5 to 1.5. A normal creatinine range is used to check for kidney function. So a lot of facilities are still doing blood work to check the creatinine before MRI scans. I know at the outpatient clinic setting, they are before you give contrast. Some hospitals have not been doing the lab check for creatinine, but it is used to test the renal/kidney function. Could you all let me know in the comment box if you work at a hospital or a clinic And if y'all are still doing the creatinine check, I just want to know, like, if people are still doing it or not, because I know a lot of places, especially in the hospital, they have stopped. All right, so if you could, please leave me a comment and let me know if you would like more questions on patient care, physics, anatomy, which part of the test you think you would need the most help on. Whenever I see comments about what people will need help on, it helps me to be able to guide these videos to make certain videos for you all to study. So if a lot of people are saying physics, I can put more physics questions in. If a lot of people are saying anatomy, I can do more anatomy questions. But I just I just have to go by and just test what I think you all pretty much don't know unless you all just leave me a comment and let me know, hey, could you make more questions on this or that? And I'm thinking about doing like a registry review video. Let me know if you want me to make it or not. But check out my playlist. I do have other MRI registry prep videos for you. Question 13. A glomerular filtration rate or GFR number of blank is considered low and you must reach out to the radiology for approval before administering MRI contrast. A 30, B 45, C 60, or D 120. All right, the correct answer is A 30. So with radiology, the department that gives contrast, anything below 40, we have to talk to the radiologist and say, hey, the patient is being scanned for this, or they have an order for this. Their GFR is 20, or their GFR is 37 or 39. Should we proceed with the contrast? Should we reduce the dose? Do you want us to ask the doctor if they should just change to it without? The radiologist would say, hey, yeah, go ahead. Since they have cancer or since they have tumor, or they're trying to rule out stroke, or if they're trying to rule out a malignant tumor, yes, we need contrast. Give this amount based off their weight or reduce the dose. They will let you know that. If they feel like the MRI scan would be just as good without contrast and it's low, they'll say, okay, this patient has poor kidney function, they're on dialysis. Just tell the doctor we are changing to it without. So just reach out to your radiologist. Question 14. An MRI patient is found unresponsive on the MRI table. What must be done in order to seek help for the patient? A. Call a code blue. B. Call the radiology nurse. C. Call the radiologist. D. Hit the quench button. All right, the correct answer is call a code blue. So I tried calling the radiology nurse before, and the radiology nurse was like, pretty much don't call us, call the code team. And at the time, I didn't know because I was PRN at this place. So the first thing I thought about was just calling the radiology nurse. I'm like, okay, this is what they're there for. But they wanted me to call a code blue team. You would not call the radiologist because, like I was saying, you have to call a code blue team. And then you don't want to hit the quench button because the patient is just unresponsive. It is an emergency. That's why you need to hurry up, undock the table, and just pull them out of the scanner. So a code blue team, they must be notified if a patient is found unresponsive. This alert sends an alarm and page for the medical team to come, which includes a doctor, nurses, radiologic techs, because they are going to take most of the time they may have to take a chest x-ray, respiratory therapy to, check the patient's breathing if needed. So the radiology nurse may not have all of the proper equipment and experience to monitor the patient. A respiratory therapist must come down to assess the patient's breathing. Do not hit the quench button, like I was saying, unless the patient is in a life-threatening situation. Since the patient was only found unresponsive, you can call for help and remove the patient from the table. Of course, do not let the code team inside the MRI suite 4. You have to have the patient removed from MRI, from the MRI room, and then they can assess the patient, but they cannot go in zone 4. Question 15. Fill in the blank. 120 millimeters of mercury is considered a diastolic blood pressure or B, systolic blood pressure. So I paused for a second because I wanted you all to think, what could it have possibly been? So here are your answer choices, A or B, and then I'll give you a few seconds to think about it. All right, the correct answer is systolic blood pressure. So as you can see, 120 millimeters of mercury is the top number for this blood pressure monitor, and then the bottom number, which is 75, that's the diastolic number. You have your pulse rate is the 71 number. Question 16. Which of the following lab tests is used to check kidney function before administering MRI contrast? A, blood urea nitrogen or bond. B, blood glucose test. C, partial thromboplastin time or PTT. D, prothrombin time or PT. All right, the correct answer is A, blood urea nitrogen or your bond. So this is used to check the kidney function. A normal bond range is 7 to 25. Question 17, and if I'm going too fast, you can pause the video or rewind it, please. Urinary catheter bags must be placed A, above the waist level of the patient, B, below the waist level of the patient, C, in the patient's hand, D, on the patient's lap. All right, the correct answer is B, below the waist level of the patient. And the reason why a urinary catheter bag must be placed below the waist level of a patient is to prevent urine from flowing backward into the bladder, which can cause an infection. Question 18. The normal pulse rate for children is A, 20 to 60 beats per minute, B, 60 to 100 beats per minute, C, 70 to 120 beats per minute, D, 100 to 140 beats per minute. Okay, the correct answer is C, 70 to 120 beats per minute. Do you all, or have you all scanned like pediatric patients before? Have you all scanned babies or children? At the hospital I work at, we do not scan pediatrics a lot or even babies because we have two major children hospitals, and then they also have other clinics for children. So the hospital I work at, we hardly ever scan babies. But let me know in the comment box if you have scanned one or not. Question 19. A normal respiration rate for children is A, 5 to 10 breaths per minute, B, 12 to 20 breaths per minute, C, 15 to 40 breaths per minute, D, 20 to 30 breaths per minute. All right, the correct answer is D, 20 to 30 breaths per minute. Question 20. A patient with hypoxia have A, high blood pressure, B, high blood sugar, C, low blood pressure, D, low oxygen levels. Okay, the correct answer is D, low oxygen levels. Question 20. The normal oxygen range level is A, 70% to 90%, B, 80% to 95%, C, 90% to 120%, D, 95% to 100%. All right, the correct answer is D, 95% to 100%. Question 21. The best way to reduce the spread of infections and germs are A, hand sanitizer, B, using soap and water, C, using water, D, wearing gloves. Okay, the correct answer is B, using soap and water. In hospitals, hand washing with soap and water is generally considered more effective than using hand sanitizer. Let me know in the comment box if you got this question wrong. And I say that because I know patient care seems easy, but believe it or not, a lot of people struggle with patient care on the test because this is like one of the sections everyone just brush off and they're like, oh, it's patient care. Patient care is easy. So let me know in the comment box if you got question 21 wrong. So if you did get it wrong, type question 21 wrong. Well, don't type that because everyone's going to go to the video and they're going to say, oh, so this is the wrong question. So just type, I got question 21 wrong or something like that. Or you can just type question 21. Question 22. A mild adverse reaction to contrast is A, facial edema, B, seizure, C, sneezing, D, wheezing. Okay, the correct answer is C, sneezing. Question 23. A moderate adverse reaction to contrast is A, facial edema, B, nausea, C, sneezing, D, wheezing. Okay, the correct answer is A, facial edema. Question 24. A severe adverse reaction to contrast is A, facial edema, B, nausea, C, seizure, D, sneezing. Okay, the correct answer is C, seizure. Question 25. A patient has an eye injury that involved metal shavings. What exam must be ordered before the patient undergo an MRI scan? A, X-ray images, B, CT scan, C, physical exam by their doctor, D, ultrasound scan. All right, the correct answer is X-ray images. So the reason why it's not like CT scan or physical exam by their doctor or even an ultrasound scan is because the plain X-ray film or images, it will allow the radiologist to see if there is like any type of metal shavings in the patient's eye, around their eye, close to their muscle, because it can pull or jerk and cause like serious problems if in the MRI machine if we do not find it. So the only way is to see it on plain X-ray. So a CT scan can be ordered if the X-ray does not show anything and the patient is like saying, I know for a fact it's still in there. Then if the X-ray doesn't show anything, the CT can and will. A physical exam by the doctor is not going to help because there's so much the doctor can do and the doctor can see, especially those tiny pieces of metal. So the physician is probably unable to identify and see that as an X-ray can. An ultrasound would not be used to confirm or deny metal shavings before an MRI scan. So there are a lot of times I've had to reach out to the radiologist and ask them and tell them that, hey, I think I need MRI clearance for this patient. They give me the approval after looking at or looking to see if the patient has any previous x-rays. Because if the patient has previous x-rays, and they'll just look at that or a previous CT scan and go from there. But if they don't, then they will tell us to reach out to the doctor for new orders. So have you all had a patient where you had to reach out or get MRI clearance for like metal shavings or even like um, shrapnel? All right, so if you all could please leave a comment for me, let me all know which registry exam you are preparing for. It doesn't matter. I'm just trying to see how many people are in ART versus ARMRIT. This video and all my other videos is going to be used to help students prepare for ART and ARMRIT. I'm just trying to see how many people are studying one versus the other. Thank you. Question 26. A stat brain MRI scan was ordered from the emergency department. The patient has a pacemaker and the ER doctor is wanting the exam done right away to rule out a stroke. The patient does not have the MRI implant card but was scanned at a different hospital 1 week ago. What should you do? A. Call the radiologist for approval. B. Do not scan the patient until you have the pacemaker implant card. C. Do the scan since the ER doctor is requesting it. D. Do the scan because the patient was scanned 1 week ago. All right, the correct answer is B, do not scan the patient until you have the pacemaker implant card. So regardless if the patient was scanned 1 week ago, 1 day ago, that day, it doesn't matter because just because the patient was scanned doesn't mean it was the right thing to do. And then just because the patient was scanned on a different scanner doesn't mean the patient need to be scanned on your scanner. And regardless, the patient has to make sure that the leads is correct, the pacemaker will work, and the representative from the pacemaker company can even put the pacemaker in MRI scan mode. And calling the radiologist really doesn't make a difference because they are not going to approve an MRI scan without an implant card anyway. So even though the ER doctor is like being persistent and insisting that you do the scan, you can't do the scan because you have to follow the hospital policy and protocol, and that is to screen every patient. So I always tell people, protect your license, protect your patient, protect your MRI environment because that's your suite, that's your environment. You're the one that has control over it. Question 27. An electronic device was found on a patient's lumbar spine x-ray. The patient does not have their card or remote controller, but the nurse states that the patient was scanned yesterday at the facility. How should you proceed with the MRI lumbar scan? A, call the radiologist for approval. B, do not scan the patient until you have the implant card. C, do the scan since the patient was scanned yesterday. D, perform the scan and give the patient an emergency call ball to squeeze if needed. Okay, the correct answer is B, do not scan the patient until you have the implant card. So, regardless if the patient was scanned yesterday, like I was saying that same day, you cannot scan anyone unless there is an implant card. Calling the radiologist is not going to help because they're not going to approve anything without an implant card. Do not scan the patient because the last tech may not even have noticed that the patient had a device or a stimulator without an implant card. I always double check everything. There was a time where someone put a patient on the schedule for a pacemaker and didn't even see that the patient also had a stimulator. So you always have to just double check for yourself, and the patient not may not even be able to get the MRI scan done because maybe it's a different coil, maybe it's a different procedure. It could be that the patient doesn't have their remote control at this time to make sure that that the stimulator is even charged for the scan. So it's just different factors that you must like consider whenever you are going through and looking at implants. Question 28. The Food and Drug Administration, FDA, regulates A, acoustic noise, B, how long a patient is being scanned, C, patient's belongings, items, and clothing, D, the length of the MRI scanner. All right, the correct answer is A, acoustic noise. So the patient must wear earplugs, headphones, or earplugs and headphones. The patient cannot use their own hearing protection. Remember, I told you that I've had patients who come in, they bring their own earplugs or they bring their own headphones and say they want to listen to music through their own headphones or use their own earplugs. They cannot because it has not been approved, regulated, or tested by the FDA to even be able to tolerate the MRI scan noise. Question 29. Which mode should the patient be scanned in? A, normal operating mode. B, first level control operating mode. C, second level controlled operating mode. D, third level controlled operating mode. All right, the correct answer is A, normal operating mode. Question 30. The International Commission on Non-Ionizing Radiation Protection recommends the use of ear protection for noise levels A, 50 decibel, B, above 80 decibel, C, below 80 decibel, D, below 60 decibel. Right, the correct answer is B, above 80 decibel. So, like I was saying, you have to give the patient earplugs and or headphones. They cannot just be scanned without anything. Even if they say they're deaf, their hearing is going out, they don't care about their hearing. They can say they're 100 years old and they don't need to hear anything. It doesn't matter. They have to have some type of hearing protection. All right, so that's it for this video. Could you please give the video a thumbs up or leave a comment if you found this video to be helpful to you? Also, you can hit the subscribe button for more videos so that you do not miss any new videos that I post. Also, the easiest way to find my other MRI videos, I'm going to, and I'm sure you can see it up here for you to click on, but I'm going to put a lot or a few of the questions for you to click on, also the playlist, so you can just get to and you can watch the videos like that. Be sure to leave a comment if you want me to make more videos, because I don't know unless I get comments or a thumbs up saying, hey, make more videos. Other than that, I'm just going to think you all have everything that you need. And but anyway, thank you all for watching. If you made it this far, put in the comment box, I made it, or I made it this far, or I watched until the end, or put I seen everything. Just let me know something along those lines that you was able to catch the whole video. All right, thank you all for watching, and bye.